billion US is the current value of the healthcare sector in India, with a projected growth of 280 billion by 2020. With a compound annual growth rate of 21%, the healthcare sector is definitely one of the most progressive and promising sectors in recent times. Despite the impressive growth, the healthcare scenario is a paradox. While on the one hand we have world-class hospitals, state-of-the-art technology and highly qualified doctors attracting patients from all over the globe, and on the other hand we have the average Indian patient who faces high prices, inadequate access and inconsistent quality. Keeping this in mind, BW Businessworld brings to you the Healthcare Summit 2014, which aims to bring the best minds of the industry, debate, discuss and strategize to catalyze change for a better healthcare future in India. The first panel, Healthcare Policy Opportunities, Challenges and the Way Forward for the Indian Healthcare Sector, discussed on the progress of the Indian healthcare systems has made in the past decade and also churned out the opportunities, challenges and the way forward.
I want to inform you that already under National Health Mission, we give incentives to states to take up this assurance scheme. It is already there in embryo, and 5 states have taken it up, and we have made a provision of 2,000 crores.
So I think it's a great opportunity where private sector can very easily come along with us in terms of providing ease of service. A lot of design and system issues that are presently hampering the services that we are providing in public health institutions can easily be overcome by technology.
The government doesn't recognize NABH's quality standards, so to speak, and goes to hospitals that are not accredited, and then starts comparing through tenders, price points. There's going to be a big dilemma out there.
So when we talk about accreditation, it is quite strange, and I think this can be corrected now. The NABH comes under the Ministry of Commerce and Industry, and NABL comes under the Ministry of Science and Technology. Now, our humble submission would be that you should now, as even Sanjay Baru has said, an accidental Prime Minister, the Prime Minister says, never give up your space. So, sir, please get these spaces back to yourselves, and I think we'll be able to move a step forward.
Hospitals of the future, intelligent infrastructure to reduce operating costs and improve patient care was the second high-powered session, which discussed the need for modern design, international examples and factors affecting cost.
That is precisely what is going to happen in the future, and that is improved quality with reduced cost. And that, I think, is the way forward. We all realize that it is aimed at minimal invasion, shorter hospital stay and quicker recovery. This implies reduced costs. So what we will see is that many of the diseases that we currently treat would be treated, quote unquote, but at an age before they become clinically manifest, and therefore overall reduce the cost of healthcare delivery.
Healthcare is the unique sector where the heart and the brain has to have a balance. You are treating human beings, you are treating them for whether it is for serious disease or whatever, but the heart has to play a role. But end of the day, you have to run it like any other business. You have to, how does quality come? Quality comes if you invest in improvement. Investment comes if you make certain profits. So I think that balancing is very important for future hospitals.
So you go into a healthcare system. I remember when I entered Fortis 11 years ago and I spoke to many of our senior doctors, and this with no disrespect. I think the point that they said was, this is not manufacturing industry, it's about people. And this is different. For us to continuously, work at management processes, at systems which are going to make us more and more efficient. So there's one entire dimension around management processes. You may not necessarily change technology, but the way that you work, the way that you look at the issues, the way you narrow down, the way you protocolize, the way you standardize, and you slice out wastage after wastage. So that's one dimension.
The 12th five-year plan as well seeks to strengthen the initiatives taken in the 11th five-year plan to expand the reach of the healthcare and work towards the long-term objectives of establishing a system of universal health coverage in the country. Hospital chains have emerged as standalone corporate entities, as have diagnostic providers.
Well, we've seen in the past a lot of policies that are coming out that have been retrospective in effect, that probably have scared or discouraged investments to come in. A lot of Indian houses per se, if you look at investments that have happened over the last 3 to 5 years, a lot of Indian houses are investing abroad more than investing in their own country, and that trend has actually increased over the last couple of years. Globalization is good, and I don't have an issue around that, but you have to invest in your own home base as well, which has been lacking over the last couple of years.
What do you need to develop this sector is primarily, one is right technology, so that you can give right delivery at the right cost, right manpower and right capital. So if you see that today most of the technology in the country is imported, so that brings up the cost as the dollar goes up and the new technologies get developed. And the second is the number of professionals available in the country have to go up, otherwise the cost of getting that professional goes up. And the third is easy availability of funding. So I am sure as the days go by, when we look at all these three, we will be able to provide affordable healthcare at right cost and right places if these three are fundamentally looked after in terms of policy.
About 35 to 40% of the investment required by any new healthcare deliverer, that is hospital, when it starts up, is on technology, which is a very large percentage, I think next to land. So if a country supports, if India and the government supports local innovation and local manufacturing, there would be possibility of dramatic cost reduction. So cost reduction of technology should be translated into cost reduction of patient care or healthcare delivery.
The next session, Embrace Change and Innovate, leveraging technology innovations to drive improvements in healthcare, dived deep into the next steps for technology in health.
Actually, health technology assessment means, have you clinically compared outcomes of two technologies? Or have you compared the clinical outcome of technology which is an intervention to a control which is doing nothing? Have you done cost effectiveness? So all costly technologies and innovations may be actually more cost effective, and there is a methodology to do it. Legal, ethical and regulatory aspects of all technology. So when we do a health technology assessment, we look at clinical effectiveness, we look at cost effectiveness, we look at legal, regulatory and social aspects.
What currently the investment in IT in healthcare is only about meeting the needs to serve the patients. It is not about using IT to actually deliver care. Also, we are not actually using IT to improve the quality of care, to make it more affordable, to make it more accessible, and even to improve the performance of the healthcare delivery organizations. But what we are not investing in is e-prescription, which is a very, very important requirement for the patients. If you want to empower the patients to take care of the healthcare, you need to give them the prescription online. You need to make the healthcare records available electronically. We are not doing that.
The key challenges that we face in the health industry today, if you look at the public health landscape, today the government is investing massively on several national health programs. In fact, if you look at the amount of investment, bulk of the investment is on child maternal health care. Secondly, if you look at, there has been a lot of investment on communicable diseases, but there is also a lot of other national programs around anti-malaria, TB, AIDS, cancer. But if you really look at from an IT perspective, all these systems has built its own MIS systems or reporting systems in a way, but none of these systems really talk to each other. So clearly there is a lot of inefficiencies and having multiple patient IDs across each of these systems. So how do you really eliminate these types of redundancy in the system? Second thing is, most of the data entry that happening in all these systems, it's pretty much manual processes. So how do you really automate the workflows, make the health system much more efficient? And data exchange, again, I talked about, which is again very important issue that we face today in the health systems in India.
How private equity and venture capital can catalyze a paradigm shift in the industry, both from providers as well as consumers' perspective, was the aim of the session. Money Matters, investing in healthcare solutions of tomorrow.
To look at the extent of investment that this sector needs, which will run into at least $40 to $50 billion if you have to come anywhere near relevant global standards. So I think expecting the public to be really provider of this case, I think is just a kind of socialistic conviction which possibly doesn't really meet any of the realities in the market. So I think let's assume that public and private together will have to make this thing happen, and to that extent,
this country is actually poised to become a sick country. And until and unless there is some very strong focus in terms of preventive strategies, in terms of fundamentally trying to deal with the management of disease itself, we are going to be facing huge problems. And I think it hasn't even started as yet. We keep talking about beds, we keep talking about investments, and we know that that demand-supply curve again is something which is impossible to fill up at least over the next couple of generations of ours. But if I were to just look at it from an NCD perspective, I think the management of NCDs in the country requires a totally renewed focus. It requires the same kind of focus as this country has had in the last couple of years on environment. You know, all of a sudden, everybody began to talk about environment because there was this huge global push that happened in terms of correcting environmental situations. And until and unless we begin to think of health under the similar bucket, and particularly putting NCDs under a similar bucket, we are not able to really going to be focusing on it beyond a point. So the way that I see it, I think there is a very clear-cut role. There is a role of the public sector, there is a role of the government, and then there is a very clear-cut role on the private side.
As we've all been talking about in one way or another, it's key to, you have to find the right partner, and it's a marriage, and you have to be happy in it. And sometimes this issue, for us as an investor, we have to figure out, is there really a potential integrity issue and we need to walk away? Or is this part of just the learning process and growing pains of the transition from the entrepreneur to then operating a more mature corporate entity? And is your promoter open to learning? Is your promoter open to understanding that the kind of things that we're going to ask him to do in governance aren't just a hassle for him, aren't a cost, but in a way it's an investment for him in his business to make it more sustainable, to open him up to a wider range of investors who might not have looked at him before.
The healthcare is priority service industry which is rarely affected by economic downturn, and investors can easily capitalize on the money invested. However, most of the current investments in private healthcare are taking place in the large metropolitan cities and in the tertiary care space. There is a crying need for investments in Tier 2 cities where there is a demand for healthcare services and incentives from government for setting up health infrastructure.
The healthcare industry will continue to expand for the simple reason that even today, although it's a statistic that we should all be ashamed of, that 70% of this 70 billion that you mentioned is funded by private individuals out of their own pockets. And that's a real shame because many countries in sub-Saharan Africa have a much better statistic on that particular account. So I think that the healthcare needs will continue to expand, technology will come in, there will be supply, and therefore the industry will continue to grow.
The partnerships have also worked in areas where there was a complete lack of infrastructure. For example, 20,000 ambulances work on partnership model. If partnership contracts have inbuilt strategy to keep it free from overutilization patterns, partnerships work well.
As per statistics, health insurance business premiums are expected to reach 30,000 crore rupees by 2015, registering an increase of 302% from 2011. Health insurance financing the healthcare needs of 1.2 billion was the last session of the summit, which discussed updates in regulations, business potential for the health insurance industry in emerging markets.
Since 2001, that's the time when health insurance really gained ground amid the entry of private insurance companies. It still remains a minor contributor to the current healthcare ecosystem.
What needs to be appreciated about RSBY is that it has taken 30 years for the insurance industry, and even now we are covering something close to 6 crore people. And RSBY in 5 years has been able to cover 12 crore people, 12 crore lives, almost double in 1/5 the time. So there must be something right with the scheme to reach that kind of scale in such a short period.
There is a complete maldistribution of medical aid. So there is an acute concentration in the major metros. There is underutilization of the rural workforce. The primary healthcare facilities have not been strengthened for many, many years.
For me, the critical thing is that the delivery of healthcare
When you do it through a public-private partnership and when you do it through an insurance mechanism, which is both public sector insurance companies and with private sector participation, you get much more efficiency of delivery and you get reducing costs.